Welcome to our comprehensive guide on prostate health. Today, we're going to explore a topic that's crucial for men's well-being, yet often overlooked or surrounded by discomfort and myth. Did you know that nearly 50% of men over 50 face prostate-related issues? It's a staggering statistic, but here's the good news. With simple, effective methods, we can significantly improve prostate health and overall quality of life. Let's start by breaking the silence. For too long, prostate health has been a taboo subject, whispered about in hushed tones or avoided altogether. But it's time to change that narrative. Your prostate health is nothing to be ashamed of. It's an integral part of your overall well-being, and it deserves your attention and care. In this video, we'll guide you through everything you need to know about maintaining a healthy prostate. From understanding what the prostate does and recognizing early warning signs, to adopting lifestyle changes that can make a real difference. We'll explore the latest in prevention, detection, and treatment, giving you the tools to take control of your health. But before we dive into the details, let's take a moment to understand why this matters so much. Your prostate, though small, plays a big role in your reproductive system and overall health. It's about the size of a walnut and sits just below the bladder, surrounding part of the urethra. Its main job is to produce fluid that nourishes and protects sperm. When your prostate is healthy, you probably don't think about it much. But when problems arise, they can affect everything from your urinary function to your sexual health and even your emotional well-being. The most common issues men face with their prostate are benign prostatic hyperplasia, BPH, which is an enlargement of the prostate, and prostate cancer. While BPH is not cancerous, it can cause uncomfortable urinary symptoms. Prostate cancer, on the other hand, is the second most common cancer in men worldwide. The good news is that with early detection and proper care, both conditions can be managed effectively. Now, let's talk about risk factors. Age is the primary factor. As you get older, your risk increases. Family history also plays a role, especially for prostate cancer. If your father or brother had prostate cancer, your risk is higher. Diet and lifestyle choices also impact your prostate health. A diet high in red meat and dairy products may increase your risk, while a diet rich in fruits, vegetables, and healthy fats may help protect your prostate. But here's the most important thing to remember. Many prostate issues are preventable or manageable with the right approach. That's why we're here today, to empower you with knowledge and practical strategies to keep your prostate healthy. Throughout this video, we'll cover a range of topics designed to give you a comprehensive understanding of prostate health. We'll start by teaching you how to recognize early warning signs, those subtle changes in your body that might be trying to tell you something's not quite right. Then, we'll dive into prevention strategies, exploring how simple changes in diet, exercise, and daily habits can make a big difference. We'll also tackle some of the myths and misconceptions surrounding prostate health. There's a lot of misinformation out there, and we want to make sure you have the facts. We'll answer common questions and provide clarity on issues that might have been confusing or worrying you. As we go through this journey together, remember that taking care of your prostate is an act of self-care. It's about treating your body with respect and giving it the attention it deserves. It's about being proactive rather than reactive when it comes to your health. We know that for some of you, this might be the first time you're really delving into this topic. Perhaps you've been avoiding it out of fear or embarrassment, but we want you to know that there's nothing to be ashamed of. By watching this video, you're taking an important step towards better health and a better quality of life. So, let's get started on this journey to better prostate health. We're going to equip you with the knowledge and tools you need to take control of your health. Remember, small changes can lead to big results, whether it's adjusting your diet, incorporating more exercise into your routine, or simply being more aware of your body's signals. Every step you take is a step towards better health. Stay with us as we explore the world of prostate health. We promise to keep things clear, practical, and, most importantly, actionable. By the end of this video, you'll have a toolbox full of strategies to keep your prostate healthy and your quality of life high. Now, let's dive into our first topic: recognizing the early signs of prostate issues. Knowing what to look out for is your first line of defense in maintaining prostate health. The most common symptoms often involve changes in your urinary habits. For instance, you might notice that you're having trouble starting to urinate, or that your urine stream is weaker than it used to be. Maybe you're finding yourself needing to urinate more frequently, especially at night. These changes might seem minor at first, but they're important signals that shouldn't be ignored. You might also experience a feeling of not being able to completely empty your bladder, or notice that you're dribbling after you think you've finished urinating. While these symptoms can be uncomfortable or embarrassing to talk about, it's crucial to pay attention to them and discuss them with your healthcare provider. It's not just urinary symptoms you should be aware of. Some men experience pain or discomfort in the lower back, hips, or pelvic area. This could be a sign of prostate issues, particularly if it's persistent or gets worse over time. During sexual activity, you might notice changes too. Pain during ejaculation or a decrease in the amount of semen are both symptoms that warrant attention. Remember, experiencing these symptoms doesn't necessarily mean you have a serious problem. Many of these can be caused by benign conditions that are easily treatable. The key is not to ignore them or hope they'll go away on their own. Early detection and treatment can make a world of difference in managing prostate health issues. Now, let's talk about the importance of regular checkups. Even if you're not experiencing any symptoms, routine screenings are vital, especially as you get older. The American Cancer Society recommends that men should have a discussion with their healthcare provider about prostate cancer screening at age 50 for those at average risk. If you're at higher risk, for example, if you're African American or have a family history of prostate cancer, this conversation should start earlier, around age 45. These screenings typically involve a blood test called a prostate-specific antigen, PSA test, and a digital rectal exam, DRE. While these tests might sound intimidating, they're quick, relatively painless, and can provide valuable information about your prostate health. Your doctor can explain these tests in more detail and help you decide what's right for you based on your individual risk factors and overall health. Let's shift gears and talk about prevention. While some risk factors for prostate issues like age and family history are out of your control, there's a lot you can do to maintain a healthy prostate. One of the most powerful tools at your disposal is your diet. What you eat can have a significant impact on your prostate health. A diet that's good for your prostate is also good for your overall health. It should be rich in fruits, vegetables, whole grains, and healthy fats. Some specific foods have been linked to better prostate health. For example, tomatoes are rich in a nutrient called lycopene, which some studies suggest may help lower the risk of prostate cancer. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that may help protect against prostate cancer. Fatty fish like salmon, mackerel, and sardines are excellent sources of omega-3 fatty acids, which have anti-inflammatory properties that may benefit prostate health. If you're not a fan of fish, you can also get omega-3s from plant sources like flax seeds and chia seeds. On the flip side, there are some foods you might want to limit. Red meat and dairy products, especially when consumed in large quantities, have been associated with an increased risk of prostate cancer in some studies. Processed foods, which are often high in unhealthy fats and added sugars, are best consumed in moderation. But eating well is just one piece of the puzzle. Regular physical activity is another crucial component of prostate health. Exercise helps maintain a healthy weight, reduces inflammation in the body, and can help balance hormone levels, all of which are beneficial for your prostate. You don't need to become a marathon runner to reap the benefits of exercise. Even moderate activity, like brisk walking for 30 minutes a day, can make a difference. If you're not currently active, Start small and gradually increase your activity level. Find activities you enjoy, whether it's swimming, cycling, or playing a sport, because the best exercise routine is one you'll stick with. Specific exercises that target the pelvic floor muscles, known as Kegel exercises, can be particularly beneficial for prostate health. These exercises strengthen the muscles that support the bladder and bowel and can help improve urinary control. They're easy to do and can be done discreetly almost anywhere. Now, let's talk about the importance of staying hydrated. Proper hydration is crucial for overall health, including prostate health. When you're well hydrated, you urinate more frequently, which helps flush out the bladder and urethra. This can help prevent the buildup of substances that might irritate the prostate. How much water should you drink? While individual needs vary, a general rule of thumb is to aim for about 8 8-ounce glasses of water a day. But don't just rely on thirst as an indicator. By the time you feel thirsty, you're already slightly dehydrated. Make it a habit to drink water regularly throughout the day. If you find it challenging to remember to drink enough water, try some of these tips. Carry a water bottle with you, set reminders on your phone, or use an app to track your water intake. You can also increase your fluid intake by eating foods with high water content, like watermelon, cucumbers, and zucchini. However, it's important to note that while staying hydrated is crucial, you should avoid drinking large amounts of fluid right before bedtime. This can lead to nighttime urination, which can disrupt your sleep and potentially exacerbate prostate symptoms. Speaking of sleep, let's touch on the importance of good sleep habits for prostate health. Quality sleep is essential for overall health, including the health of your prostate. During sleep, your body repairs and regenerates tissues, balances hormones, and strengthens your immune system. Aim for 7 to 9 hours of sleep per night. Establish a regular sleep schedule by going to bed and waking up at the same time each day, even on weekends. Create a relaxing bedtime routine to help you wind down. This might include reading a book, listening to calming music, or practicing some gentle stretches. If you're having trouble sleeping, especially due to frequent nighttime urination, talk to your healthcare provider. They can help determine if this is related to a prostate issue and suggest appropriate treatments or lifestyle changes. In our next section, we'll delve deeper into stress management and its impact on prostate health. We'll explore techniques for reducing stress and promoting overall well-being, which can have a positive effect on your prostate health. Remember, taking care of your prostate is an integral part of taking care of your overall health. Every step you take towards a healthier lifestyle is a step towards a healthier prostate. Now, let's dive into the critical topic of stress management and its profound impact on prostate health. In our fast-paced world, stress has become an unwelcome companion for many of us. But what you might not realize is that chronic stress can have a significant negative effect on your prostate health. When you're stressed, your body releases hormones like cortisol and adrenaline. While these hormones are helpful in short bursts, chronic elevation can lead to inflammation throughout your body, including in your prostate. This inflammation can exacerbate existing prostate issues or potentially contribute to the development of new ones. Moreover, stress can indirectly affect your prostate health by influencing your behavior. When we're stressed, we're more likely to make poor dietary choices, skip exercise, or engage in unhealthy habits like excessive alcohol consumption or smoking, all of which can negatively impact prostate health. So, what can you do to manage stress effectively? Let's explore some practical techniques that you can incorporate into your daily routine. First, let's talk about breathing exercises. One simple yet powerful technique is the 4-7-8 breathing method. Here's how it works. Inhale quietly through your nose for 4 seconds, hold your breath for 7 seconds, then exhale completely through your mouth for 8 seconds. This cycle is repeated 4 times. This technique can help activate your body's relaxation response, reducing stress and promoting a sense of calm. Meditation is another excellent tool for stress reduction. Don't be intimidated if you've never tried it before. Meditation can be as simple as sitting quietly and focusing on your breath for a few minutes each day. There are many guided meditation apps available that can help you get started. Even just 5 to 10 minutes of meditation daily can make a significant difference in your stress levels. Physical activity is not only good for your overall health and prostate function, but it's also a fantastic stress buster. Exercise releases endorphins, the body's natural mood elevators. Whether it's a brisk walk in nature, a yoga session, or a swim, find an activity you enjoy and make it a regular part of your routine. Engaging in hobbies and activities you love is another great way to manage stress. Whether it's gardening, painting, playing a musical instrument, or solving puzzles, these activities can provide a much-needed mental break and boost your mood. Don't underestimate the power of social connections in managing stress. Spending time with friends and loved ones, sharing your concerns, and enjoying positive interactions can significantly reduce stress levels. Even in our digital age, make an effort to maintain face-to-face connections when possible. Now let's address an often overlooked aspect of stress management: sleep quality. Poor sleep and high stress levels often go hand in hand, creating a vicious cycle. We touched on sleep earlier, but it's worth emphasizing its importance in stress management. To improve your sleep quality, try to create a sleep-friendly environment. Keep your bedroom dark, quiet, and cool. Avoid screens, phones, tablets, computers for at least an hour before bedtime, as the blue light they emit can interfere with your body's natural sleep-wake cycle. Consider establishing a relaxing pre-sleep routine. This might include reading a book, listening to soothing music, or practicing gentle stretches. Consistency is key. Try to go to bed and wake up at the same time each day, even on weekends. If racing thoughts keep you awake at night, try keeping a notepad by your bed. Jot down any worries or to-do items that pop into your mind. This can help clear your mind and allow you to relax into sleep. Remember, managing stress is not about eliminating it entirely. That's not realistic in today's world. Instead, it's about developing healthy coping mechanisms and resilience. It's okay to feel stressed sometimes. What matters is how you respond to that stress. Now, let's shift our focus to another crucial aspect of prostate health: the impact of various substances on your prostate. We'll start with alcohol consumption, a topic that often raises questions when it comes to prostate health. Moderate alcohol consumption has been a subject of debate in the medical community. While some studies suggest that moderate drinking might have some health benefits, when it comes to prostate health, the picture is less clear. Excessive alcohol consumption has been linked to an increased risk of aggressive prostate cancer in some studies. If you do choose to drink alcohol, moderation is key. The American Cancer Society recommends limiting alcohol intake to no more than 2 drinks per day for men. One drink is defined as 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof distilled spirits. When it comes to choosing your drink, some evidence suggests that red wine might have some protective effects due to its high content of antioxidants, particularly resveratrol. However, this doesn't mean you should start drinking red wine if you don't already. The potential risks of alcohol consumption may outweigh any benefits. If you're looking for alternatives, consider non-alcoholic options like sparkling water with a splash of fruit juice or herbal teas. These can be satisfying alternatives in social situations where others might be drinking alcohol. Now, let's address another substance that can have a significant impact on prostate health: tobacco. If you're a smoker, quitting is one of the best things you can do for your overall health, including your prostate health. Smoking has been linked to an increased risk of aggressive prostate cancer and poorer outcomes for those diagnosed with prostate cancer. Quitting smoking is challenging, but there are many resources available to help. Nicotine replacement therapies, prescription medications, and counseling can all be effective tools in quitting. Don't be discouraged if you've tried to quit before and weren't successful. Many people make several attempts before quitting for good. Even if you're not a smoker, it's important to avoid secondhand smoke as much as possible. If you live with a smoker, encourage them to smoke outside and to consider quitting. Let's move on to another important topic: the role of sexual health in prostate wellness. This is an area that many men feel uncomfortable discussing, but it's crucial for maintaining prostate health. Regular sexual activity, including ejaculation, may have benefits for prostate health. Some studies suggest that frequent ejaculation might be associated with a lower risk of prostate cancer, although more research is needed to fully understand this relationship. It's important to note that regular doesn't mean there's a specific number of times you should be sexually active. What's considered regular varies from person to person and can change throughout your life. The key is to maintain a healthy sex life that feels right for you and your partner. If you're experiencing sexual problems such as erectile dysfunction or loss of libido, don't hesitate to discuss these issues with your healthcare provider. These problems can sometimes be early indicators of prostate issues or other health conditions. Moreover, addressing these concerns can improve your overall quality of life and relationship satisfaction. Now, let's explore an exciting area that's revolutionizing prostate healthcare: technological innovations and advancements in diagnosis and treatment. The field of urology has seen remarkable progress in recent years, offering new hope and improved outcomes for men dealing with prostate issues. One of the most significant advancements has been in imaging technology. Traditional methods of diagnosing prostate cancer, such as prostate-specific antigen, PSA, blood tests, and digital rectal exams, while still important, have limitations. They can sometimes lead to overdiagnosis and unnecessary treatment of slow-growing cancers that may never cause symptoms. Enter multiparametric MRI, MPMRI, a game-changing technology in prostate cancer detection. This advanced imaging technique combines multiple types of MRI scans to create a detailed picture of the prostate. It can help doctors identify suspicious areas that might be cancerous, guide biopsies more accurately, and even sometimes avoid unnecessary biopsies altogether. The precision offered by MPMRI means that if a biopsy is needed, it can be targeted to specific areas of concern rather than taking samples randomly. This targeted approach, known as MRI-guided biopsy, can improve the accuracy of diagnosis while reducing the number of tissue samples needed. Another exciting development is the use of artificial intelligence, AI, in prostate cancer detection. AI algorithms are being developed that can analyze MRI images and help radiologists identify potential cancerous lesions more accurately. While this technology is still in its early stages, it shows great promise for improving early detection and reducing human error. When it comes to treatment, there have been significant advancements in minimally invasive procedures. For men with benign prostatic hyperplasia, BPH, a condition where the prostate becomes enlarged but not cancerous, new options are available that can provide relief with fewer side effects than traditional surgeries. One such option is the UroLift system, a minimally invasive treatment that lifts and holds the enlarged prostate tissue out of the way, relieving pressure on the urethra and allowing urine to flow more freely. This procedure can often be done in an outpatient setting and has a quicker recovery time compared to traditional prostate surgeries. For men with localized prostate cancer, focal therapy is an emerging option. This approach aims to treat only the cancerous part of the prostate, sparing the rest of the gland and potentially reducing side effects. High-intensity focused ultrasound, SHIFU, is one type of focal therapy that uses precise beams of ultrasound energy to heat and destroy cancer cells in a specific area of the prostate. Advancements have also been made in radiation therapy for prostate cancer. Techniques like intensity-modulated radiation therapy, IMRT, and image-guided radiation therapy, IGRT, allow for more precise targeting of cancer cells while minimizing damage to surrounding healthy tissue. This can lead to fewer side effects and better quality of life during and after treatment. For men with advanced prostate cancer, targeted therapies are offering new hope. These treatments are designed to attack specific features of cancer cells or their environment. For example, PARP inhibitors are a class of drugs that have shown promise in treating certain types of advanced prostate cancer, particularly in men with specific genetic mutations. It's important to note that while these advancements are exciting, they may not be appropriate for everyone. The best treatment approach depends on various factors, including the stage and grade of the cancer, overall health, and personal preferences. Always discuss your options thoroughly with your healthcare team to determine the best course of action for your individual situation. Now let's address some common myths and misconceptions about prostate health. Misinformation can lead to unnecessary worry or, conversely, a false sense of security. By clearing up these myths, we hope to empower you with accurate knowledge to make informed decisions about your health. Myth 1. Only old men get prostate cancer. Fact. While it's true that the risk of prostate cancer increases with age, it can affect younger men too. Men in their 40s and 50s can and do get diagnosed with prostate cancer. That's why it's important to discuss prostate cancer screening with your doctor, especially if you have risk factors like a family history of the disease. Myth 2. If I don't have any symptoms, my prostate must be healthy. Fact. Many prostate conditions, including early-stage prostate cancer, may not cause any noticeable symptoms. This is why regular checkups and screenings are so important. By the time symptoms appear, a condition may be more advanced and potentially harder to treat. Myth 3. Sexual activity increases the risk of prostate cancer. Fact. This is a common misconception. In fact, some studies suggest that regular ejaculation may be associated with a lower risk of prostate cancer. However, it's important to practice safe sex to protect against sexually transmitted infections, which can affect prostate health. Myth 4. Prostate problems always lead to cancer. Fact. Not all prostate problems are cancerous. Conditions like benign prostatic hyperplasia, BPH, and prostatitis are common and non-cancerous. However, they can cause uncomfortable symptoms and should still be evaluated by a healthcare provider. Myth 5. Eating tomatoes will prevent prostate cancer. Fact. While tomatoes are rich in lycopene, a nutrient that may have some protective effects against prostate cancer, no single food can prevent or cure cancer. A balanced, healthy diet that includes a variety of fruits and vegetables is beneficial for overall health, including prostate health. Myth 6. Prostate cancer treatment always leads to incontinence and impotence. Fact. While these can be side effects of some prostate cancer treatments, advancements in treatment techniques have significantly reduced the risk and severity of these side effects. Many men maintain good urinary control and sexual function after treatment. It's important to discuss potential side effects and treatment options with your doctor. Myth 7. Prostate supplements can shrink an enlarged prostate. Fact. While some supplements claim to improve prostate health, there's limited scientific evidence to support these claims. Always consult with your healthcare provider before starting any supplement regimen, as some can interact with medications or have unwanted side effects. Now that we've cleared up some common misconceptions, let's move on to a practical section. Creating a daily routine for optimal prostate health. Remember, small, consistent changes can make a big difference over time. Here's an example of how you might structure your day to support your prostate health. Morning. Start your day with a glass of water to stay hydrated. Enjoy a breakfast rich in fruits, whole grains, and possibly some nuts or seeds for healthy fats. Take a brisk 15-30-minute walk to get your blood flowing and reduce stress. Mid-morning. Have a healthy snack like an apple with a small handful of almonds. Take a few minutes to practice deep breathing or meditation to manage stress. Lunch. Opt for a meal with lean protein, like grilled chicken or fish, and plenty of vegetables. Choose water or unsweetened tea instead of sugary drinks. Afternoon. Take a short break to stretch or do some light exercises, especially if you have a desk job. Have another glass of water to stay hydrated throughout the day. Evening. Prepare a dinner rich in vegetables, perhaps including some cruciferous veggies like broccoli or cauliflower. Limit alcohol consumption, opting for water or herbal tea instead. Engage in a relaxing activity like reading or listening to music to wind down. Before bed, avoid large amounts of fluid close to bedtime to reduce nighttime urination. Practice good sleep hygiene. Keep your bedroom cool, dark, and quiet. Aim for 7 to 9 hours of quality sleep. Remember, this is just an example, and you should tailor your routine to fit your lifestyle and preferences. The key is to incorporate healthy habits consistently throughout your day. It's also important to track your progress and any changes you notice in your health. Consider keeping a journal to record your diet, exercise, sleep patterns, and any symptoms you may experience. This information can be invaluable when discussing your health with your healthcare provider. Speaking of healthcare providers, let's talk about the importance of regular checkups and open communication with your doctor. Many men feel uncomfortable discussing prostate health, but remember, your doctor is there to help you, not judge you. When you visit your doctor, be prepared to discuss any symptoms or concerns you may have, no matter how minor they might seem. Sometimes, what you think is a small issue could be an important clue for your doctor. Don't hesitate to ask questions. There's no such thing as a silly question when it comes to your health. If your doctor recommends a prostate exam or PSA test, try not to feel anxious. These are routine procedures that can provide valuable information about your prostate health. The brief discomfort of an exam is far outweighed by the potential benefits of early detection and treatment of any issues. Remember, your doctor is your partner in maintaining your health. Be honest about your lifestyle, including your diet, exercise habits, and any medications or supplements you're taking. This information helps your doctor provide the best care possible. Now, let's address a topic that many men find challenging: talking about prostate health with friends and family. While it might feel awkward at first, open conversations about health can be incredibly beneficial. They can help raise awareness, provide support, and even encourage others to take care of their own health. If you're comfortable, consider sharing your prostate health journey with close friends or F. By opening up, you could create a supportive network where you can share experiences, advice, and encouragement. For those of you who have partners, involving them in your prostate health journey can be incredibly helpful. They can provide emotional support, help you remember to stick to healthy habits, and even assist in monitoring any symptoms or changes you experience. If you're finding it difficult to start these conversations, remember that you don't have to disclose everything at once. You could begin by simply mentioning that you're taking steps to improve your overall health, including your prostate health. As you become more comfortable, you can share more details if you choose to. Now, as we near the end of our comprehensive Guide to Prostate Health, let's take a moment to recap the key points we've covered. 1. Understanding your prostate. We've learned about the role of the prostate in men's health and the common issues that can affect it. 2. Recognizing warning signs. We've discussed the importance of being aware of changes in your body and not ignoring potential symptoms. 3. Preventive measures. We've explored how diet, exercise, stress management, and other lifestyle factors can impact prostate health. 4. The importance of hydration. We've emphasized the role of proper hydration in maintaining prostate health. 5. Stress management. We've discussed various techniques to manage stress, which can have a significant impact on overall health, including prostate health. 6. Sleep quality. We've highlighted the importance of good sleep habits for prostate health and overall well-being. 7. Substance use. We've addressed how alcohol and tobacco can affect prostate health and provided guidance on moderation and cessation. 8. Sexual health. we've discussed the relationship between sexual activity and prostate health, emphasizing the importance of maintaining a healthy sex life. 9. Technological advancements. We've explored exciting new developments in prostate health diagnosis and treatment. 10. Myths and facts. We've debunked common misconceptions about prostate health to provide you with accurate information. 11. Daily routine. We've provided an example of how to structure your day to support prostate health. 12. Communication. We've emphasized the importance of open dialogue with healthcare providers, friends, and family about prostate health. Remember, taking care of your prostate is an integral part of your overall health. The steps you take to maintain a healthy prostate, like eating a balanced diet, staying active, managing stress, and getting regular checkups, are beneficial for your entire body. It's never too early or too late to start prioritizing your prostate health. Whether you're in your 30s and just beginning to think about prostate health, or you're in your 60s and dealing with prostate issues, there are always steps you can take to improve your health and quality of life. We hope this comprehensive guide has provided you with valuable information and practical strategies to maintain and improve your prostate health. Remember, knowledge is power, but it's the actions you take based on that knowledge that truly make a difference. As we conclude, we want to emphasize that you're not alone on this journey. There are millions of men around the world taking steps to improve their prostate health. By prioritizing your health, you're setting a positive example for your friends, family, and community. We encourage you to take the information you've learned today and put it into action. Start with small, manageable changes and build from there. Maybe it's adding an extra serving of vegetables to your meals, setting aside time for daily relaxation, or scheduling that checkup you've been putting off. Every positive step, no matter how small, is a step in the right direction. Remember, maintaining good prostate health is a lifelong journey, not a destination. Be patient with yourself, celebrate your progress, and don't get discouraged by setbacks. Your body will thank you for the care and attention you're giving it. Thank you for joining us on this exploration of prostate health. We hope you feel empowered and motivated to take control of your health. Remember, a healthy prostate contributes to a healthier, happier you. Before we sign off, we'd like to remind you that while this guide provides general information about prostate health, it's not a substitute for professional medical advice. Always consult with your healthcare provider for personalized guidance and care. We encourage you to continue learning about prostate health and to stay informed about the latest developments in this field. Science is constantly evolving, and new discoveries are being made all the time. If you found this information helpful, please consider sharing it with others who might benefit. By spreading awareness about prostate health, why? Thank you for your attention and commitment to your health. Here's to your continued well-being and a future of optimal prostate health. Stay well, stay informed, and keep taking those positive steps forward. Your prostate and your overall health will thank you.